Why your jawline disappears after 40. Many patients believe their jawline disappeared because they gained weight. But for many people, the process starts long before the scales change. The jawline changes because the entire lower face changes with age. And understanding these changes is the key to natural treatment. A sharp jawline is not simply skin stretched over bone. It depends on bone support, fat distribution, ligaments, muscles and skin quality. When one component changes, the entire jawline changes. Aging affects all of these structures simultaneously. One of the least appreciated causes of jawline aging is bone remodeling. The mandible gradually loses projection and support. The chin may become shorter and retrusive. As the foundation changes, the soft tissues above it lose support. Aging is not simply a process of losing fat. Some fat compartments shrink while others descend. Volume gradually moves from the cheeks toward the lower face. This contributes to heaviness around the jawline. Jowls develop because tissues descend around fixed retaining ligaments. The mandibular ligament remains fixed while surrounding tissues move. This creates fullness beside the ligament and hollowness in front of it. The result is loss of a smooth jawline contour. The platysma muscle changes with age. The muscle becomes more active and visible. Platysmal pull contributes to loss of jawline definition and neck banding. The lower face and neck should always be assessed together. Collagen and elastin decline with age. The skin gradually becomes thinner and less elastic. This allows tissues to descend further. No amount of filler can completely compensate for significant skin laxity. Patients often request jawline filler to recreate youthful definition. But if the main problem is skin laxity or jowl formation, filler may add heaviness. The face becomes wider rather than sharper. Treating the symptom rather than the cause often produces disappointing outcomes. A weak or aging chin affects the entire lower face. Loss of chin projection reduces the apparent definition of the jawline. In selected patients, chin support may improve the whole lower face. Sometimes improving the chin improves the jawline. Many lower face problems actually begin in the midface. Cheek support declines with age. Tissues descend downward and contribute to jowl formation. This is why experienced injectors assess the whole face rather than a single area. Significant jowls and neck laxity often respond better to surgery. Facelifts reposition tissues rather than adding volume. In selected patients, surgery may produce more natural results than repeated filler. Good medicine means recommending the right treatment rather than the available treatment. Small age-related changes are often easier to manage than advanced aging. Early intervention may preserve facial balance and proportions. But prevention should never become over-treatment. The goal is to maintain identity rather than create a different face. Understanding lower face aging requires more than learning injection techniques. It requires understanding anatomy, retaining ligaments, fat compartments, and facial aging. These are exactly the concepts explored in Anatomy for Injectors and the Cadaver Dissection Workshop for Injectors. Because good treatment starts with understanding the cause of the problem. If you enjoy evidence-based education in anatomy, injectables and aesthetic medicine, subscribe to Dr. Ben Chan at ASI. Thank you for watching and I will see you in the next video.